So yeah, now we are welcoming Zekai Li from University of Groningen, and he'll be giving us a talk about hybrid kernelized PET reconstruction that allows for negative values.
Yeah. Yeah. Tricky hard. Yeah. Yes. Hello, everyone. My name is Zekai Li. I'm a PhD student at the University Medical Center of Groningen, and today I'm presenting my work, hybrid kernelized PET reconstruction, allowing for negative values. Well, the older subset expectation maximization method, so-called OSEM, is most commonly used PET reconstruction algorithm in clinical setting. However, it suffers from the problem about the positive bias in low count regions due to the non-negativity constraint. So a lot of different researchers have already developed and also validated the ABOSEM method, which can reduce the bias by lowering negative voxel values, but it typically increases the noise compared with the normal OSEM. And another well-known reconstruction method, as introduced already by Professor Guobao Wang, is kernelized EM. So I won't spend too much time on this because Professor Guobao Wang has explained all the aspects of this method. So in principle, it incorporates the prior information of the kernels to improve the PET image quality and quantification. So there is another method, called HKEM. It extends the KEM by combining the anatomical priors with also the PET updates. So it has already been implemented in the open source software for tomographic image reconstruction by Daniel. So our ideas here is like we can both use the benefits of removing the positive bias from the AOSM, but also keep on using the kernel method to try to improve the image quality. So what we have is very like the on the left is the traditional ABOSM method. So we use the lowercase b as upper bound and lowercase a as lower bound. However, now we only care about the lower bound because we want to remove the positive constraint from the OSEM. So we can simply reduce the formula from left to the right, and we only have one lower bound left here. The other part is mainly the simplest OSM. So we can borrow the same idea to the KEM. On the left, we have the classical kernelized method, and the K is a kernel matrix, and alpha is the coefficient and the vector to estimate. So we can just simply add the lower bounds and try to reformulate the formula on the right. Here, in this study, we mainly use the PET-CT scanner. So what we have is the ACCT acquired before the PET acquisition or after the PET acquisition. So we simply use the ACCT here as the prior information and modeled as a Gaussian kernel. And as I said, for the HKEM, we use the PET update image also as a prior information. So we modeled them as a Gaussian kernel on the right. Here we have a very good example. It's immunopET. So immunopET plays a very important role in targeted therapy and immunotherapy, and recently it's more and more popular in the field. However, it's always, not always, but it's imaged the intact monoclonal antibodies, always labeled with longer half-life than radionuclides such as the zirconium-89, which has 3.3 days half-life. And also, due to this long half-life and also the typically slow kinetic of this type of tracers, it typically involves the low injection dose. It's, for example, about 37 MBq, and it's always imaged at the late time points, for example, day 7 post-injection. On the right is the example of the zirconium-89 tezolizumab for imaging the PD-L1 receptor for selection of the CAR T-cell therapy. So you can see from this image, the activity concentration for each voxel is quite low. So we think maybe it's a proper data set for testing this algorithms. Here, in the dataset following, we use the Siemens Biograph Vision Quadra PET CT scanner and for 25 minutes acquisition. So we also have done the co-registration between the PET and CT. Nowadays, we have already implemented the pipeline for reconstruction Siemens Quadra data in the open source software STIR. So we can just reconstruct the sinogram generated from the Siemens E7 tools and pre-processed for the Quadra. And of course, all the reconstruction algorithms are implemented within STIR. So there are some settings here for the iterations, the subsets, or the voxel size, or the matrix size. We just follow the same setting as we usually do in clinic. And if we apply the Gaussian filter, we just apply the 5mm Gaussian filter, which is also what we commonly done in our hospital. And for the versions allowing for the lower bound, we always use the lower bound as minus 0.1 at this time. And for the kernels, we have these hyperparameters defined only for this application. So here are the reconstructed images. So on the left is a co-registered CT, and on the right are the reconstructed image from all relevant reconstruction algorithms we tested. So on the first floor, on the first row, it's like the traditional classical reconstruction algorithms from OSM to the KEM or HKM. And on the second row are the versions allowing for the negative voxel values. So from the visualization, we could now see pretty much differences between the first row and second row. Of course, the second row should be a little bit more noisier than the first row. So what we do is like we histogram the reconstructed voxel values. So we here on the from the 5% to 95% percentile, and on the left the histogram shows the all classical reconstruction method. So you can see clearly from here it truncates at the value of 0, and they all follows the asymmetric log normal distribution as we can expect from previous studies. And on the right side is the AOSM. AKM and HKM we tested. So they all follow somehow symmetric distribution, and the AOSM has a little bit spread out comparing the other method. So we have also a very simple test on the tumor background ratio. So it will take like ROI on the tumor and also the background, and we calculate the TBR. So you can see the all A versions, like which allows for the negative values, has higher TBR comparing to the normal method. Here we can conclude that the algorithms with lower bound change the voxel value distribution by relaxing the 0 lower bound. And they produce less truncated and more symmetric voxel distributions, while the kernel method further reduces the spread and improves the image quality comparing to the OSEM. However, as we see here, we only have one set of hyperparameters. We definitely need to do much more work on trying different lower bounds and kernel parameters to understand the algorithms more and to try to find the best performance. Of course, as Professor Gobon and others have already mentioned, we can have different kernel designs. We can use deep kernels or other methods for further improve this algorithm. Yeah, thank you.
Thank you very much for the talk. The talk now is open for questions. So perhaps I can start. So yeah. You showed the histogram with the negative values, and what else can we gain or what kind of information we can derive from these negative values? So
yeah, so in principle, well, when we talk about the positive bias, it's because of the region. If we constrain the region always with, because OSM has the implicit constraint of positive, right? So if we have the region only has the positive values. So the distribution will not cover the negative parts, right? So the mean value of that RI should be higher than it should be. But if we have this Gaussian distribution, then we can somehow get, in principle, can somehow get a better estimation of this type of mean value of the RIs. Yeah.
Okay. Yeah, thank you. Any other question? Yes, please.
So can I just follow up on this?
Yeah, yeah.
So I try to understand, so if you look at the AOSEM, that blue curve, it seems very symmetrical
Yes.
compared to the other three, but the mean appeared exactly the same. I was a little surprised. And also I wonder whether they're actually, you know, what should be the true mean?
No, we don't know because it's patient data, so we
Okay.
don't have a ground truth.
But,
Yeah.
but then can you explain why I thought the OSEM should have a much lower mean, given that how symmetric that curve is?
Well, regarding this, I could not comment much more. Yeah, I was also a little bit surprised by the mean is the same, but I double checked. I think it's really the same. Yeah. I mean, what we can expect from here is like the AOSM has a little bit more spread out compared to others. But for this part, I would do more experiment to check it later, I guess. Yeah.
Thank you.
Really very nice work, and that's a really good modification to potentially correct the bias in KEM. I was just wondering,
Yep.
What's your current strategy for choosing that lower bound?
Yeah.
You know, for your Zekai data set. I know you perhaps have more work to do to refine the strategy, but what is your current strategy?
It's like because from Andrew's paper before, you show if we, if the lower bounds covered somehow the range of the values. Like if we have very low bounds, then the performance should be somehow like reduces a little bit of bias. So here, because we have the raw values, like arbitrary values, has very low values. So minus 0.1 has already covered the range of voxel values. So we think maybe it's a good first start of the test.
Okay, we have another question from Teams from Dimitra. Have you characterized the null space directions that appear once sign constraints are relaxed? They're wondering whether cancellation modes could become a hidden source of instability.
Sorry, I'm not sure if I understand the question, sorry.
Okay, have you characterized the null space directions that appear once sign constraints are relaxed? No? Okay. Mm-hmm. And another question is, if the method mixes kernels and sign coefficients, is there a natural crane space or indefinite kernel viewpoint, or is it better language simply constrained factorization? Okay.
I need to say I don't have a lot of experience with this question, so I could not really give a lot of comments. Sorry.
Okay, maybe then it's a discussion after the talk.
Yeah, please.
Okay.
Yeah.
Let's thank the Zekai Li and